Welcome to the Confidence Through Health podcast. My name is Jerry Snyder. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. As an elite level runner and coach, I'm excited to introduce you to the All In Running Club. The All In Running Club exists to help you become a better runner. Whether you're a beginner, an elite runner, or anywhere in between, the mission of the All In Running Club is to give you the tools you need to find your success in running. Join today to take advantage of the 75% off yearly membership rate offer. Click the link below in the show notes to learn more. So, Dr. Leeds, I want to thank you for being a guest on the Confidence Through Health podcast.
It is my pleasure. Happy to be here. Happy to talk with you.
So, as I told you before we started recording, I'm really excited to have you on because I have yet to have somebody with a dentistry background in knowing how important that connection is to overall health. Tell us why, because I always find that to be curious. I have a cousin who went on to dentistry school and is a practicing dentist in Fort Worth. And I think that's the most common question people get is, why do you want to stick your hands in people's mouths all the day?
That is a fabulous question. First of all, I'll apologize to all your listeners and subscribers, for my profession, and
Right.
what a terrible job we've done scaring people all these years. It's finally getting better, but as recently as the last couple of years, there's 1 in 5 people in the U.S. that don't go to the dentist at all because of fear.
Yeah.
And 20% of our whole industry is not happening because people are still afraid to go. And, that's we can start with the takeaway from the whole podcast. If you're going to a place that makes you that fearful, you're going to the wrong place. I mean, dentistry in 2024 should be comfortable. It should be like a spa treatment. It should be something you look forward to. You should feel better when you leave.
Right.
These are the qualities of a good office and a good team, people that are taking care of folks. Yeah. But dentistry for me was one of those things I wanted to be a pediatrician when I was in 9th grade. I loved kids. I loved sports. I loved working with groups of kids. And I thought, I'll be a pediatrician. And so I was interested in medicine. My father was a mechanical engineer, almost always worked for somebody else until late in his career. So he's like, son, you can be your own boss. You can live wherever you want to. You'll always have a job. Things you talked about back in the 80s, when I was growing up. And so, I was actually, I'll never forget it. I was president of the student body at the little university, a little land grant school where I went to school in Arkansas. And I was standing there. I had a necktie on and a collared shirt, and I was moving tables around because that's what you have to do, show up these volunteer things and career fairs and things like that. And in walked Dr. Fantastic Phil Dowdle, who sang in the Bellevue Baptist Church choir, which is on TV every Sunday morning in Memphis, Tennessee on Channel 4 and NBC, a 100-person choir. Mm-hmm. He's singing, but Phil was he loved his job. He was the director of admissions at University of Tennessee College of Dentistry. And he and I were the only 2 people in this room. He was there early with his stuff for the career fair, trying to recruit some dental students. Right. And I was a chemistry major who happened to be there in a necktie. And he said to me, he took an interest. Somebody took an interest in me and said, what are you doing here? And I said, well, I'm president of the student body, and this is part of my job. I get a little scholarship, and nobody wanted it, and I ran unopposed. How about that? Nice. So, and succeeded actually my wife. She was the president of the student body the year before me. So I think we're the only husband and wife to ever do that. Nice. Which is kind of cool and means absolutely nothing now in our lives. Somebody told me I could be on her cabinet as a parliamentarian and get a $1,400 a semester scholarship to meet twice a week with a pretty girl. I was like, hey, I'm down. Sign me up. You're going to pay me to do this, really? You sure? I might do this for free. So I'm standing there with Phil, and he says to me, well, you're a chemistry major, you said. And I said, yes. And he said, well, you should go to dental school. And I said, oh, really? And he said, yeah. I said, well, I'm planning on going to med school. He said, well, we can help you get it. Anyway, in Arkansas doesn't have a dental school. Insert your, tooth hillbilly joke here, if you want. We're about to have one, actually. We've just, Lyon College in Arkansas has partnered with a company, some friends of mine, Merritt Dake, and some guys with a company called One Health. We're actually going to put a new dental school in a lovely facility in Little Rock called the Heifer. It's a Heifer Project building, which is a wonderful charity, by the way. Yeah. but it's right by the Clinton Library in Little Rock. Beautiful facility. So I think they're going to take their first class in 2025. So anyway, I was encouraged by someone who made my path a little bit more interesting and easier. And I
Yeah.
connected with Phil Dowdle, and he was a great admissions director, and he got me interested and ended up getting me a scholarship, and I went to dental school. So that's how I got interested. And I mean, I was thinking about medicine anyway.
Sure.
And I always tell people, I never wanted to stick my fingers in anybody's mouth. But it always beats the other end. That's what, so
Right. That's true.
you don't want to be a proctologist, right? But some people, the oral cavity does gross people out
Yeah.
completely, and I get that. But I'll tell you, in my career, we take universal precautions, right? We wear masks and safety glasses and gloves. I can't tell you when I, smelled halitosis. I mean,
Yeah.
I've got a mask on. I've got nice smelling stuff in my office. I mean, so I don't, I mean, and obviously people that have really, really bad gum disease, you could smell them from the parking lot. So there is
Right.
some of that.
Right.
But I mean, it's there are grosser things. There are dirtier
Oh,
jobs,
sure.
whatever
Sure.
Mike's name is,
Yeah.
But I love people, and I knew that I wanted to help people and be in a profession where I could interact with people every day. And I was an outgoing guy. And so into dentistry I went with no foreknowledge, by the way. A lot of dentists are second generation, third generation, their grandpa was an orthodontist, something like that.
Right.
Not this guy. I mean, I didn't know polyvinyl siloxane from, ethylene glycol. I mean, I didn't, I didn't know from purple jelly. I didn't know,
Yeah.
what it was. And so I had to learn, a lot of these people came in with a little bit of a leg up. But I got interested in dental school because I was going to med school anyway. It seemed like an interesting specialty that, where I could be my own boss and live where I wanted to be and take care of people and, not have to deal with the horrible loss of losing a patient. It's true. And I was a pretty sentimental guy. So knowing that, God forbid we don't, we don't have somebody die in the dental office, which they usually say it'll be the doctor, so keep an ED around, as a health game. I mean, I got to have a way to shock ourselves back sometimes as doctors who need more of your coaching, so we can run better, lose some weight, stay healthy. Yeah. But that's how I got interested in dental school, and I'll try not to chase as many rabbits as we move forward.
No, that's good. Well, and so, but to me, like, as I'm making the connection now of like, okay, you've got that medical school sort of like dream back there in wanting to help people. And so what you're taking now, as far as like just the regular dentistry side of things, and going, oh, well, but look at the connection with overall health, and look at the connection with sleep, and look at the connection with da 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 da. And so for me, it's like, it's almost like when he came into your life and said you should look at dental school, it was like that the opening of like, oh, you're the guy that can connect both pieces together for everybody.
Yeah. Well, and when I became a CPAP sleep apnea patient myself, everything changed in my dental practice. We started taking blood pressure on every patient. We started treating the whole person. We already did pretty much, but we really started focusing on, if somebody's not sleeping well, they're going to get anxiety, depression. They're going to be overweight. They're going to have because we know that about 80% of our health is affected in some way by how well we sleep.
Oh yeah.
And so, we're learning more and more about this. But when I was in dental school, we did not spend 15 minutes on the oral cavity's interaction with sleep. It was not covered at all. I understand that in most medical schools, there's not 2 credit hours, but 2 total elapsed time hours spent talking about sleep. And with it being so important for every major organ system and how we restore ourselves, and then we have this society where everybody's running and working 2 jobs, and the job market's so great right now, we can't even find all the workers we need. So it's everybody's busy and stressed, and sleep is so important.
Well, and one of the things that to connect sleep and dentistry for myself, from my own experience, I remember going into the dentist, and this was probably 10 years ago. And I was like, I've got a sensation in this tooth. It's like it's really starting to irritate me a lot. And so he's looking at it and he's like, well, I don't really see usually a crack in that direction. Usually it's a different crack. It's like your crack is different. And he's like, so he automatically said, how's your sleep? What are you doing? And come to find out, I wasn't sleeping well because I was grinding my teeth, and I was grinding so hard I cracked the tooth. And so of course got the tooth fixed, but then got a mouth guard that I still use to this day. I mean, not the same one, but I still use a mouth guard to this day to help me prevent grinding, but also solidify my sleep all the way through so I'm not waking up because I'm grinding so much, you know?
Right.
Um,
Well, it's interesting you bring those two things up. Do you know how often our teeth should be in contact during a 24-hour day total?
no,
It's only 2 minutes total. Should your
really.
enamel on your upper arch touch the lower arch? And that's when we swallow. That's the only time enamel should be together.
Wow.
So everybody who's out there listening, if you're grinding your teeth right now at your desk and firing your masseter muscles in your jaws, stop doing that.
Right.
So your swing thought every day, like if we're coaching a golfer,
Mhm.
they say you want to have three simple thoughts that you can fit on an index card because there's too much to think about in the golf swing.
Mhm.
If you're thinking about something more specific than that, you're gonna louse it up.
Yep.
So my one thought for people who have trouble grinding: lips together, teeth apart, breathing through the nose all day
Yep.
long. Humans are obligate nasal breathers. We need to be breathing effortlessly and visibly,
Yep.
quietly through our nose all the time. When you're running, if you're breathing through your nose, you're enacting a little endocrine sensor in your parasinus area that's secreting nitric oxide. It's
Yep.
the only time this happens in our physiology. And that, because it's a vasodilator, so you're going to run better if
Yep.
you're breathing through your nose. It's okay to exhale through your mouth, but take the air in through your nose. It's going to
Yep.
help people perform better athletically.
Yep.
But so and then grinding patients. I had a patient person I was talking to yesterday, grandmother, and she said my granddaughter has ground half of her baby teeth off.
Oof.
Okay, that is a child that is trying to breathe.
Yep.
Because when we can't breathe through our nose for some reason, the brain sends signals to our jaws. Okay, slam the teeth together and move the jaws around with the teeth together until we can get in a position so we can open the airway and
Mhm.
complete inspiration,
Right.
respiration.
Right.
And so those two things, people that grind are people who are trying to breathe.
Yeah.
That's just what we know in sleep health now in 2024.
Well, and so that connects a lot of dots for me, like that things that I've tried and started implementing, but not necessarily know. I mean, I know a little bit about what's going on internally, but like you're connecting more dots for me now in that it was 2021 where I read Breath by James Nestor.
Yep.
And I was like, all right, I'm gonna try and start nasal breathing only. I was swore to that point in my life, I could not exercise and breathe through my nose, period. Like I would have told you, there's no way possible. I can't do it. Um, and it took me 3 months of consistently, consciously thinking about it every time I went to run. And now I could run in and out of my nose the entire time until I get to like a really, really fast pace. And
Yeah.
then I'm using my mouth. Um, but I can run at a nice, comfortable pace for me, never open my mouth at all during the run.
Yeah.
Um, and I've noticed that, my performance is better. Like I'm calmer through it. Um, and now I've taken that to the rest of my life. So I sleep without breathing through my mouth, and um, and it does play a massive factor in your overall health, I think, because I've
Oh,
noticed
no
myself,
question.
like and I'm in tune with what I do and with myself, and I've noticed the improvement.
Yeah. Well, and everybody knows how we feel when we wake up and we've had poor sleep or
Hmm.
great.
Hmm.
And the problem is out there, with that's why we wrote the book about kids, is because sometimes we don't know that. We think that, if I've got to wake my child up in the morning to get them ready for school, they must be a heavy sleeper. They must be sleeping great. But what's happening is they've probably just gone to sleep at 5 a.m. or something. They're just
Yeah.
or with deep sleep. So, you know, it's so important. And we've got people out there trying to function. We got truck drivers out there that are narcoleptic. They're not sleeping.
Yeah.
They're behind the wheel. I mean, this is serious stuff. And we've got to
Yeah.
get everybody sleeping better and help folks get healthy.
Yeah. And and so it's things like grinding your teeth or not being able to breathe properly. When that wakes you up and disrupts your sleep cycle,
Yes,
it's not just, oh, I was in bed for 8 hours, so I should be fine, right? It's
that's
like
right.
you
Yeah.
want to be
Yeah.
undisturbed.
Yeah, or what we call it sleep fragmentation, right?
Right.
We want sleep to be productive sleep, restorative sleep, not
Right.
fragmented and restless sleep. I mean, I have patients who the index that we use to measure their sleep apnea is not all that high, but we have other, sensors that we can measure other types of their sleep, but we can still see that maybe they toss and turn a lot. They may breathe through their
Right.
nose okay, but their sleep is pretty fragmented. It's not very productive. They're not getting into REM sleep twice
Right.
a night, which is what we like everybody to do.
Yeah.
And so, yeah, there's a lot of things that we can check on. And in most states, your dentist, can do a very simple sleep test for you where you go home with a little ring that you wear on your finger. It connects to an app on your phone. There's a company called Sleep Image that makes one that I like a lot. Another company called Wesper, Wesper, that makes one. And then WatchPat Corporation now makes a sleep testing device that's disposable. So you don't have to worry about
Oh,
getting the ring back. You just take it home. You do a sleep study, wear it a couple nights, and then just throw it away.
yeah.
And with these devices, they're all 98% or north of that, as accurate as a hospital polysomnography. So
Okay.
this idea that you've got to go in and sleep with electrodes taped all over your body just doesn't have to
Right.
happen in
Right.
2010 and beyond, really.
Yeah. Well, and that's a piece that like it can identify so many things, but when it come back to the oral cavity and the sinus cavity, like because we've become mouth breathers so much, we not only limit like our ability to filter things out when we breathe through our nose, that cavity is supposed to do that, but the sinus cavity shrinks, right? And it changes our facial structure.
Yes.
And so like we correct me if I'm wrong, but I've heard that we've become a society, at least in America, of people with smaller mouths.
Oh, that's the only thing I treat. That's what I've been treating for the last 7 years, is
Yeah.
underdeveloped narrow jaws.
Yeah.
And now that you and I have talked about it, and everybody that's listened to the podcast today, you can't unsee it. Once you
Yeah.
start looking for the signs and symptoms,
Hmm.
everybody has lower crowding. If they
Yep.
open their mouth, it looks like somebody took their index finger and thumb and moved their molars and bicuspids together.
Right.
Their arches are shaped like a trapezoid instead of a rounded. We want not even the McDonald's arch. We want it to be fatter than that,
Right.
wider. And here's the tip. We really want 41 millimeters between we call our 6-year molars, or the teeth
Hmm.
that came, first permanent teeth really that came in behind your baby teeth. It's
Right.
the largest chewing surface you have in your mouth. You've got 4 of them, one in each quadrant of your mouth.
Yeah.
And upper arch, there's a little bump on the inside of the tooth that's
Mhm.
named after the doctor that named it. So
Yeah.
it's called, here's your $3 word. You ready for this? The cusp of Carabelli. That's what this is
Okay.
called. A
Nice.
little tiny bump on the inside of your tooth.
Right.
And if we stretch a linear measurement across, we want to see patients 41 millimeters across or larger.
Okay.
Most of society is walking around 35, 37 millimeters.
Yeah.
And when we have crowding between the maxillary molars, then the anterior teeth are doing this.
Right.
Palate is like a church steeple, right?
Yep.
And the palate, as you mentioned, is the floor of our sinuses and
Yeah.
our airway, which is like a triangular space in our skull that we're trying to keep open so we can breathe through
Yeah.
our nose. I've seen patients, I had a patient tell me yesterday, I've got a deviated septum. Okay, cool. So we're looking at it. But if you think about it, if the septum is deviated like
Hmm.
this and the palate is arched underneath it, it's
Hmm.
basically crunched the septum and moved
Right.
it over to one side. So I've got adult patients that we do orthodontics on them, or we expand their arches in their palate.
Hmm.
That's what happens to the septum. It's bone, just like the bone around your teeth.
Yeah.
So I've seen adults use removable expansion appliances and straighten their deviated septum by flattening the palate
Nice.
without surgery.
Yeah.
So it can happen.
Yeah. And well, and I mean, and some of that can happen just from changing the way you breathe, right? Like when we breathe through our nose, solely breathing through our nose over time, of course, like not, it's not gonna happen instantaneously, but over time, it's naturally going to start expanding and saying, okay, I'll use more, I'll use more, I'll use more, and start expanding more and more and more.
Well, the expansion in adults, it'll need a bit of an assist from some sort of an appliance that will
Okay.
help, spring activate the expansion.
Okay.
If we used to think that after the growth plates fused, we couldn't open that midline palatal suture anymore on
Hmm.
an adult.
Hmm.
Now we know we can get a little bit of expansion even in adults with
Okay.
with a spring activated device, with a removable appliance, with clear aligners. I have a laboratory in California that, it's a company called OrthoFX. It's a wonderful clear aligner company. They make the most comfortable, best fitting, most flexible, only FDA approved nighttime clear aligners.
Right.
They're really into R&D and making their aligners better every day and more comfortable for their patients. 80% of their clear aligner cases go to finish without remodeling, without doing a refinement, as we call it in our world, or rescanned.
Right.
And really only 12% of Invisalign, lump them all in there. There's 74 companies now that make clear aligners.
Right.
Only 12% of those cases go to completion without being touched again.
Oh, wow.
So it's really rare. And we're seeing with OrthoFX, that company and their founder, Ren Manon, great person, great leadership with that company. Dr. Locke Fan, really, he made the first aligners for Invisalign back in 1997. But they're still making advances with those, but they work really nicely.
Yeah. And so just to make sure that like we clarify for the parents out there, like, because my daughter's in braces. And so I'm automatically now thinking like, oh, I need to talk to her orthodontist and make sure that the braces are expanding enough. Like that's the plan. Like that it's not just straightening. Because she had a tooth that was, way out of whack in the front. And so it's like, okay, we got to get that one in place. And that's worked. She's been in them since August.
What age is she?
She's 14.
Okay. Yeah.
And so now I'm like, okay, next time I talk to the orthodontist, I need to say, okay, what are we doing in the back? Are we expanding? Are we just trying to make them look pretty? Are we actually looking for function here?
Or you can just start looking at their internal marketing and their team. You can ask one of the assistants, or just ask them a question. Just say, does my daughter's airway look okay? I'm reading a lot and hearing a lot about this. Should she be concerned about her airway? What how does her airway look like? And they'll probably have what we call a lateral cephalogram, which is a profile X-ray that they took on her when they started. Most offices, it'll be a digital film now, and they should be able to see her airway on there and tell you if it looks okay or not. And here's another trick that all your dentists and dental patients and dental team members that are listening can use, or you can use when you go back. Say, can I have a cotton roll? Just a couple cotton rolls to take with me, and they'll hand you some cotton rolls. And it's a little cylinder it's 37 millimeters long. That's how long a cotton is. And so that's our little trick in the office. We grab a little pair of cotton pliers and we take a cotton roll, and if it will fit widthwise between those molars I described earlier, then you've got at least 37 millimeters there.
Right.
And if it won't fit, which it won't on most people, it starts to bend and it hits the sides and it won't fit in the palate. So that means it's 37 millimeters or less in width. So you need at least 4, 5, 6 more millimeters of expansion.
Right. So there's other things obviously that also happen in the mouth, which lead to chronic diseases, right?
True.
Because it's our first, when we talk about food, we talk about drinks, we talk about anything that we're ingesting, it's our first contact with that stuff. And we have good bacteria and bad bacteria in our mouth, right?
422 species, by the way, of bacteria in your mouth.
Nice. And that's the first place where digestion starts. A lot of people don't realize that.
Well, it starts before we eat.
Yeah.
We start thinking about it like Pavlov's dog, right? We start salivating.
Yeah.
And, that's why we really were designed to go out and club something to death, drag it home, put it on the fire, So there was that's part of the preparation. That's why you have a lot of these people. I think Mark Zuckerberg started 10 years ago eating only meat that he killed or something,
Right.
I wonder if that still happened. Maybe he's probably just switched to fish, which is a lot easier to do that. Yeah. But the point is that your digestion process starts when you start thinking about, okay, where's the next meal coming from?
Right.
And you're right. There's so many, the bacteria, the big focus right now in dentistry on the oral biome, the oral biofilm that gets on your teeth, things that can be caused by that if the wrong type of bacteria are elevated, because it's like everything else. It's like the bacteria in your gut. It's a delicate balance, right? And that's why we don't have an antibiotic that we can give patients to cure gum disease.
Yeah.
It's because we might kill all the Streptococcus bacteria in there, but the lactobacilli or whatever, or the other Porphyromonas is still thriving. So because it
Yeah.
doesn't respond.
Yeah.
So that's, and the reason for that is that our body needs them. We need a certain amount of them. And so, and some people build some of the bacteria that are more harmful than others. I mean, I had classmates in dental school, we were teaching each other to floss and clean teeth and everything. We
Right.
would do the disclosing tablets like they used to bring around to kindergarten, the pink tablets, and
Yeah.
have everybody chew on those, and it showed you where all the plaque was, and you had to brush it off.
Right.
Well, we had to do that as dentists. We had to get we would do a plaque score so that you looked at every surface of every tooth, and to pass the class, your plaque score had to be in the healthy range. It had to be below a certain number.
Nice.
And so we had a guy, in our class that just genetically, he just had this terrible bacteria. Like I think his dad had a denture in his 30s or something, So, and these these bacteria that cause gum disease. And so literally the only way we got Greg to pass was somebody thought, well, we're going to have to put Greg on antibiotics or otherwise. And so he did his evaluation another time when he had been on 2 weeks of antibiotics, and he finally got his plaque score down. But it scared him to death because he's like, oh my God, am I going to have dentures in my 40s,
Sure.
because he's a dentist, right? So, and the answer was no. There are some things, and some rinses and things that he can use to help reduce some of those harmful bacteria, which he was able to do. And he still has all of his teeth, by the way, and he's my age now. So
good.
It all ended with.
But and so that those bacteria and like you said, the plaque and all that stuff, like if we're not taking care of our teeth, right, in brushing and using at least in my opinion, you can correct me if I'm wrong, but using a mouthwash, like if we're not doing those things and using quality products and doing it so that we know we're actually getting a good effect out of it, like then we're allowing we're allowing the good bacteria to have a home, but we're allowing that bad bacteria to continue to grow and disrupt things. And all it takes is just something to grab hold, and then that connection can go anywhere else in the body, right?
Little tiny shift. That's right. Well, it's like if you're hitting your driver, at the golf course, if you open the face, 2 degrees at impact, you could miss the green 70 yards to the right. You could be in the water at the other end, and you're only off just a little bit at impact. So same principle applies here. But back to the mouthwash stuff. There's a lot of studies that have come out showing that it's actually more harmful to use some of these alcohol-based products. And many times people just enjoy the taste. They like their breath to feel fresh, which is fine. But I mean, Listerine has alcohol in it, so it kills bacteria. But if you're in a 12-step program or something, that's no good. You put that around the house. You've got people. So so I would in 2024. In fact, in the last couple of years, there've been a lot of advances in toothpastes. A lot of research about fluoride now that's coming out. That's does it unnecessarily impact the way our pineal gland functions? There's a lot of controversy out there. So, and that's another takeaway from today's show too, is in 2015 and beyond, advocate for yourself. What you coach your clients to do all the time. Never has it been more important for us to use food as a medicine, to steal Mark Hyman's phrase. I mean, I can tell you, I mean, I'm type 2 diabetic. I mean, here I am. I've done it to myself, right? I'm over 50. Here's the thing. I mean, I played 3 sets of tennis yesterday, and I'm wearing my CGM, and I can't get my blood sugar down. And I mean, I'm in the, but if I'm hardline eating my kale, my turmeric, and the things because I can track it, and that's important too. If you don't know what your baseline is, you have no idea what data is any good for you. So, anybody who's having blood sugar issues, find a way to get a continuous glucose monitor, because you can see 30 minutes after you consume something if it bothers your blood sugar or not. And what's amazing is there are foods out there, like if I eat a handful of raw kale, it'll drop my blood sugar 30 points. I mean, 30 points. There are some protein bars that I like that will drop my blood sugar 20 to 30 points. But if I eat enriched white flour, and here we are, Southern boys, right? We grew up having biscuits and
Yep.
hush puppies and stuff like that in the
Yep.
South. And I mean, that stuff is like, you can instantly see why it's not good for you. Because
Oh
when I
yeah.
look at blood sugar, I mean, my blood sugar will double.
Yeah.
If I have a homemade buttermilk biscuit, forget about it.
Yeah.
It is. And so, so basically if you're pre-diabetic or type 2 diabetic, I mean, sugar is an allergy for you.
Yeah.
You can't get near it. I mean, well, I say that you could have a little bit of, Florida Crystals brown sugar,
Yeah.
maybe on
Right.
occasion. But if you eat a tub of ice cream, I mean, you're going to have a diabetic incident.
Right.
Well, that's why we would eat Thanksgiving dinner. Everybody took a nap. Well, it wasn't
Right.
just the hormones in the turkey; it was all the carbs and the dressing and the
Yep.
stuffing and mashed potatoes and the pumpkin pie and all the other stuff you ate. No wonder we wanted a nap. I mean,
Yeah.
blood sugar was as high as it had ever been, for that
Yeah.
person. So, yeah, you gotta take all that into consideration, starting with the
Right.
bacteria in our mouths and how digestion begins. And
Right.
you'd think the dentist would teach more about nutrition,
Yeah.
but we focus in our profession too often on fixing little holes and problems in the teeth instead
Mhm.
of the whole person.
Right. Well, and so speaking of those holes in the teeth, because there's a lot of advances that have happened there.
Yeah,
I was fortunate that I didn't have a lot of fillings growing up. Genetically, I've got better teeth than probably most people. In fact, I think all of my incidences have been, from a force cracking, not,
yeah,
a cavity that's just come over time.
right.
Um, where my wife, on the other hand, has got, like 4 or 5 silver fillings, from back in the day. And I say silver, but they're not, real silver. They're
There's a little bit of silver in there, but
a little bit, but it's,
it's what we call amalgam. There's some
yeah,
mercury and there's some other metals in
right.
there.
And so we've learned how dangerous that is, right?
Mhm.
Like we've gone away from that. And people that have those, like that's one of the things I've talked to her about a little bit is like, we really need to research getting those taken out properly and
Mhm.
refilled with something else,
Yeah.
right?
Well, I think there may even be a video on YouTube where there's a dental rubber copy, put my teeth back in, rubber Profi cup, what we use
Yeah.
in hygiene visits. And they did an infrared video of this,
Hmm.
and it supposedly shows dental amalgam, vapors coming up off the filling as it's being polished.
Yeah.
Um, and I'm kind of old school about that. Those silver fillings, I've seen them on 95-year-old people
Hmm.
that look like the day they were put in,
Yeah.
if they're done right.
Right.
And those patients don't have any memory issues or any problems,
Hmm.
And the amount of mercury that's in a dental amalgam that's, according to the American Dental Association, take that as, for what it's worth. I mean, it
Right.
is an organization that supports dentists, right? They're going to
Right.
have their take on it. But their phrase is that there's no more mercury that leaches out of a dental amalgam in your lifetime than is in your regular city drinking water. So
Okay.
that is parts per million wise, it's so
Right.
small.
Yeah.
But there are these functional dentists out there that are saying, oh God, no, get all that stuff out of the teeth.
Yeah.
But to me, it's almost like asbestos in a building.
Hmm.
You know, the problem occurs when you start trying to remove it. And
Right.
because a lot of these things, and I mean, unless there's the problem, right?
Right.
And I'll tell you, the fluoride, the mercury is, I mean, bacteria can't live in it, right?
Mhm.
So a little tiny bit of it goes a long way as far as keeping bacteria from recurring underneath a
Okay.
dental restoration.
Yeah.
And you can do them underwater. So in the back of someone's mouth, when you just can't get it dry enough to do a white filling,
Right.
um, these restorations they've got, a 300-year history of performance in a certain way. And I've kind of seen both sides of that.
Yeah.
They do, if people function on them improperly over time, they can fracture teeth if they're not
Hmm.
done right. And so it's so funny because patients would come in and they'd say, my filling broke. And they would hand me what broke. And it was always the tooth around the amalgam. The amalgam almost never
Oh,
breaks.
really? Yeah.
It acts like a wedge in a block of wood, and it'll kind of shear off a little piece of tooth enamel.
Yeah.
But those are almost never sensitive. And the treatment's the same, whether it fractured or not, which is to put
Mhm.
a crown on it. And so a lot of times, unless the filling just looked atrociously poorly done or something,
Yeah.
we would not even replace those as long as they look good on the X-ray. We would just go right over the top of those and put a nice crown on there to keep them from fracturing and
Right.
replace the enamel basically on the tooth. And those things, dental crowns made of nice porcelain don't have a lifespan. Think about that. What
Right.
other medical treatment can you have done that lasts your lifetime?
Right.
I mean, we never had a lifetime guarantee on anything in our office, but I can't remember a time when one of the crowns that I made broke and we charged somebody to replace it. I
Yeah.
mean, it happens sometimes, and especially if it was in a reasonable period of time, all it cost us was our time, and
Yeah.
and the lab was happy a lot of times too if it broke in an unreasonably short period of time, but just to remake it for us. So,
Right.
yeah, but that and dental implants, I mean, 98% success rate since 1972. Find me another more successful medical treatment. I mean, that's
Right.
more successful than cholecystectomies or
Yeah.
appendectomies. I mean,
Right.
and so, dentistry, it's held up pretty well. So
Yeah.
I'm kind of, in the middle on
Right.
dental amalgam. Depends on, in other words, I would not recommend for my patients to rush out and have them all removed.
Right.
And if it was an aesthetic concern, are they a singer, are they an actor or something where somebody,
Right.
and maybe that's okay. But if it ain't broke, don't fix it kind of thing with me. You had that done when you were 12 years old. It's been in there. It's
Yeah.
functioning just fine. You don't want to go borrowing trouble.
Right. Right. Well, and I think that's one of the biggest in again, back to like the initial, like the fear piece of it, right? Like is like, oh, well, if you have these, you need to get them out, but you need to get them out by somebody who can do it right and not expose you to more issues.
Right.
And so then it comes to that, like, sort of like you said, is like, okay, well, if it's not broken, not causing problems, and it still looks like the day it was put in, so it's obviously not breaking down or having any issues. Like, don't like you said with asbestos, like you can live in a building with asbestos if you don't mess with it.
Yeah, because unless you're, grinding on it with a device that's trying to remove the asbestos tiles from that's when you need the hazmat suit, right? And
Right,
the breathing tank. But,
right,
not going to hurt you if you're just living there.
right. Um, and so one other thing I want to, because heart disease has been just our nation's biggest like troublemaker when it comes to health.
Nope, still
Um,
number
and
one.
and I've heard this before, but I've never actually had a dentist where I could ask them and say like, okay, have you noticed this? Is this true? Is this? But I've heard that the plaque that's on your teeth is basically the same plaque that is in your arteries when you have heart problems.
Well, it's very similar. Like if you look at it under a microscope, let's
Mhm.
put it this way. It has the same type of adherence capability.
Gotcha.
In other words, the way the vascular plaque sticks to the walls, this stuff sticks to teeth. I
Right.
mean, and it's very hard,
Yeah.
uh, and hard enough that we have to use a powered or sonic instrument with
Mhm.
a blade type tip on it. Our hygienists use what we call an ultrasonic scaler
Yeah.
to get a lot of this hardened bacterial plaque off the teeth. But
Mhm.
they are similar, and they're very similar to also a kidney stone, which is the
Mhm.
medical term is renal
Right.
calculus, right?
Right.
So similar, it's probably a calcium based,
Mhm.
salt based product that gets really hard.
Yeah.
Yeah. So they're similar in at least for, who am I to opine on thoracic matters?
Right. Right.
I know that they are similar in the way they adhere to the vascular wall and the tooth structure.
So similar enough that if you're actually going to the dentist every 6 months and getting your teeth cleaned and checked and um which is really like to go back to like that's the biggest baseline like that the medical field has been able to set up and like be able to stick, I think better than anything is like 6 months, like
Well,
getting it and
where it
seeing where
comes
it's
from,
at.
right? You know
Oh,
where that standard came from.
no.
There's an old toothpaste commercial from the 1950s. It was a company called Ipana
Mhm.
toothpaste, and they had a little jingle where the jingle was like brush a new Ipana tooth, da, 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 da. And so healthy for your teeth, it would say, and at the end, a voice would come on and say, and see your dentist twice a year.
Oh,
So Ipana just came up with that as part of the marketing. Like this is not enough.
Right.
ADA, we're going to get the ADA approval. So we're going to plug the dentist and the hygienist here at the end. Well, when dental insurance companies were trying to decide, okay, how often should we pay for services or pay out benefit? They were like, well, here's a commercial that says they should see their dentist twice a year. Why don't we? Everybody's kind of already had that in the mindset.
Yeah.
So that's honestly where it came from. It came from backward marketing from a commercial.
Right.
And so what does that mean? Well, that means that all over the US, people are letting insurance, be a method of treatment for them, not a method of payment.
Right.
And I probably 10% of my patient population, the average dental office only has about 1,500 patients that are active. It's because that'll keep 2 hygienists busy, 2 appointments twice a year. That's basically how you figure it out.
Yeah.
And we call an active patient in our world somebody that is no more than 6 months plus 1 day overdue for hygiene. So right after your 6 month, twice a year thing.
Yeah.
At least 10% of my patients needed another visit per year. Probably another 5%, that needed 4 visits a year, to stay healthy, because they just had the right combination of, or whether it was their diet mixed with their bacterial, microbiome, they happen to produce more plaque than the average Joe. And so, sometimes those patients would, they wouldn't have insurance coverage for it, but we're not taking x-rays. We're not doing an exam. We're just, they're just having their teeth polished and cleaned. So, in that situation, they would just pay cash for, just to visit with us real fast and be in an hour and 30 minutes.
But that for the person who is not doing other things to take care of their health, or possibly is, but if they're having to come in 3-4 times a year to get plaque taken off, because that should be an indicator that, hey, something else could be going on inside as well. If it's the same plaque basically is what can be growing in your arteries and your blood vessels, like that should be an indicator. If you can't control it on your teeth with brushing, like there should be, you need to be checking out with your doctor as well to see, hey, what's really going on internally.
Well, the average dentist speaks to their patient about 10 to 12 minutes a year.
Yeah.
The average medical doctor speaks to their patients 10 to 12 minutes every 7 years.
Right.
So many times patients are diagnosed with a systemic health problem because the dentist or the hygienist, that's why we recommend, take blood pressure on your patient. I mean, I've had patients that in between their 6-month visits had bypass surgery. I didn't know it. That's why we have them fill out a medical history every time. Yep. Or we've had patients that had a heart murmur diagnosed since I last saw them. Well, there's lots of things in dentistry I don't need to do without them having antibiotics when that's the case.
Yeah.
So, medical history is important. You talk about heart disease. Do you know when most heart attacks occur? What time of the day?
Well, isn't it usually Monday morning?
No, it's actually really early Monday morning, like 2 a.m. It's in the night.
Yeah.
Well, what happens is at nighttime, when someone is undergoing a sleep disordered breathing event, they will stop breathing for 10 to 12 seconds. Most of my patients that have moderate to severe sleep apnea stop breathing as long as 72 seconds.
Oh my gosh. Multiple
times per night. I mean, we always tell people when we're training in different offices, we'll say, hold your breath for 10 seconds. Let's count. You count to 10 seconds. A lot of people are ready to breathe in 10 seconds. I mean, you're not, because you're very fit and you're a distance runner. So, but most people, they're ready to breathe in 10, 12 seconds. So I've got patients where they stop breathing for 10 seconds or more 90 times in a night.
Oh, wow.
And so if they have these longer episodes, what happens is we see a cardiac response. I had a dear friend who, she was feeling strange. She went and had a heart saver CT done. And they said, well, you've got your left ventricle it's just working itself to death. Why was it doing that? Well, she had sleep apnea, undiagnosed. And so her brain is saying, hey, we got to have more blood with oxygen in it. Let's go. Let's race the heart. So I can show you these sleep studies where the heart rate goes up, way high. And the T2 saturation at that same time drops way below 90%, down into the low 80s. And so that's why heart disease is still a problem. We've got a lot of patients with narrow jaws. They can't breathe through their nose. They can't sleep. So they're having these apneic events, and it's leading to heart disease and problems. if you're a patient you're listening to the podcast and you're having to see your dentist multiple times a year, in addition to your regular visits to have the plaque taken off of your teeth, you need to have your blood sugar checked immediately.
Yeah.
Type 1 diabetes undiagnosed is the most common thing that's associated systemically with rampant gum disease. I mean, if I see a patient that really has bad gum problems and they're coming to see me for the first time, we always talk about counseling with their doctor and get their blood sugar checked.
Yeah.
Because I can't tell you how many people we've diagnosed with diabetes just from a dental visit.
Oh, wow. Well, but I mean, it when you think about it, it makes total sense. The connection and the way things work, it makes
Completely
total
tied
sense.
together for sure.
Yeah. Well, Dr. Leeds, I just looked at the clock and I'm like, wow, this has been great, but I want to be conscious of your time and respectful. And so how can people connect with you, get more information about what's going on? And you've written a book. How can they get a hold of that?
Yeah, sure. I got a couple of web pages. Ask Dr. Leeds, AskDrLeeds.com.
Cool.
Go there. You can pre-order the book. I should say order the book, but it's still not out. We've had some pushing delays, which is a good thing. We're going to get it finished. But it's supposed to be out in November. Still working on it. But that'll be available. DrBlaineLeeds.com. That's my physical dental office site. I practice in Arkansas. Probably going to be opening something in Utah pretty soon. Maybe California. I'm licensed in 12 states. So come see us at one of our physical dental offices. Got a place in Nashville too. Some friends over there that I'm working with. But you can find me on all the socials. I'm on LinkedIn. I'm on Facebook. I'm on Instagram, Twitter. I'm around.
Awesome.
Look me up.
Thank you. So what would be one thing, like, one other thing maybe we haven't talked about that, like the person, the patient that you maybe see the most often about, like, okay, think about this in regards to taking care of your health.
No question. Think about clear aligner orthodontics. Think about moving your teeth around. It's not just about a pretty smile. It's not just about aesthetics.
Yeah.
It could help you breathe better.
Yeah.
And there are ways to help people breathe better tonight. I've got a colleague, Dr. Kevin Goles in Colorado. He had a patient whose apnea index was 39. That's 10 points higher than severe. Okay.
Oh, wow.
Severe sleep apnea. There's a device called a Fotona laser where we just, in about 5 minutes, we can treat the soft palate. It helps with mild laser. It helps stretch the soft palate, get it out of the way. He took a patient over a 6-week period, dropped their AHI from 39 down to 3.
Oh, wow.
0.3, almost 0. So he basically cured a patient with no appliance, no CPAP, by just tightening their tissue with laser and mild heat. So, the thing is, orthodontics is not just about straight teeth. It's about the fact that everybody is too narrow. And just about everybody out there can have their crowding and their expansion taken care of with a simple orthodontic case that's 3 to 6 months that nobody will even know you have it in their mouth. I've got people that are on local news and they're actors and they're wearing these things. Nobody even know they have them in.
Wow. That's awesome. Well, again, I want to thank you so much for being a guest. This has been a great conversation and truly helpful for everybody that listens.
My pleasure. Thanks for having me.
Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.